Hi everyone, I'm Andrea Wolfe, the CEO of the Brem Foundation, and I'm thrilled that you've joined us tonight for Brem for the Best. It's going to be an empowering and uplifting breast health online event. Before we get started and while we let people stream in, I wanted to share a little bit about our impact with you. The Brem Foundation has had an outsized impact on breast care, especially in the Washington, D.C. area. As you can see, we've touched thousands of people with our programs, and frankly, more than 1.5 million with our digital education. But really, the truth is we're just getting started, and we're thrilled that you're here with us today because we couldn't do this without you. Specifically, I'd like to thank our sponsors, patrons, and friends who made tonight possible and who make all of our programs possible. The Bayside Auto Group, Heather Diamond, Thelma D. Jones Breast Cancer Fund in honor of Jacqueline Beal and Carolyn Harvey, Cheryl and Sam Skillen, Carmen Marshall, Carrie Polk Insurance, and Barbara Burnett. We are so grateful. We also want to thank our hostesses. You all pounded the virtual pavement and became ambassadors for Brem to make tonight real, and we are so grateful. You can see all of our hostesses' names on this screen, and please, if you are friends with them or close with them, thank them for all they've done for the Brem Foundation and for breast cancer more generally. We're just going to give our participants a couple of minutes to stream in, maybe get a cup of coffee or a cocktail, something to make tonight even more fun. Hi, everyone. Thank you so much for joining us. I'm thrilled to be here with you tonight. I'm Andrea Wolfe, the CEO of the Brem Foundation. We're going to wait a few moments for our program to get started. And while we're waiting, you can enjoy some of our background information here about our hostesses, sponsors, patrons, and friends who made tonight possible. We are so grateful. Thank you all for coming. We'll begin our program in just a moment as we let people stream in. I hope you all got to enjoy this beautiful fall weather. As you know, today is October 1st, so I think it's officially fall for all of us now. Thank you all so much for coming. I'm Andrea Wolfe, CEO of the Brem Foundation to Defeat Breast Cancer. When asked what she wanted her legacy to be, Justice Ruth Bader Ginsburg said, "To make life a little better for people less fortunate than you." That's what I think a meaningful life is. One lives not just for oneself, but for one's community. On September 18th, we lost a giant. Justice Ruth Bader Ginsburg paved the way for many less fortunate than herself to lead better lives. She is, of course, most remembered for pioneering a better life for women. Whether you realize this before now or not, you are here today to fight for a women's rights issue. Breast cancer affects every community, white and Black or brown, younger and older, here and far away. It does not discriminate, but people do. And that is why we need to fight this battle on multiple fronts. First and foremost, the best way to fight breast cancer is to take care of yourself. Second, you must look behind you and over your shoulder to be sure that others are taken care of as well. That is why the Brem Foundation is here, to use our unique educational curriculum to arm you with the tools you need to know your personal risk factors, screening options, and how to self-advocate. We teach you how to address breast care in a COVID world. But the Brem Foundation doesn't stop there. We are implementing unprecedented access programs to be sure that underserved women can get the critical, life-saving care they deserve. Today is October 1st, the start of Breast Cancer Awareness Month. Last year, we focused exclusively on personalized screening and self-advocacy. These topics remain critically important, but today, we're also focusing on navigating COVID and emerging ideas about screening and racial inequities in breast care. We have so much work to do. Breast cancer incidence rates between white and Black women is about equal, but Black women die at a rate of 40% more than white women. This cannot continue. Since its inception, the Brem Foundation has always worked to close the gaps in breast care disparities. In 2006, we started the B Fund to support underserved women, the majority of whom are women of color, who could not afford diagnostic tests. In 2019, we created Wheels for Women, a program and a partnership with Lyft aimed at helping those same women get free transportation to and from breast care appointments. But this is just the beginning. Now is our moment. The time has come to ensure that COVID does not claim any more lives than it already has, to learn about personalized care and to become ambassadors for racial equality. We could not be here today without the support of some very special people. I want to thank our sponsors and hostesses. You make this all possible. I also want to say a huge and special thank you to special guest Council Member Calvin Hawkins and Alexis Solios. They have been champions for this cause for so many years. Thank you for making this happen. Finally, I want to thank two of the Brem Foundation's staunchest friends and co-founders, Sue Apple and Cheryl Skillen. Your vision and passion continue to shine through, even as the foundation grows and changes. You both embody what it means to make the world a better place. Thank you from the bottom of my heart. And thank you to all of you here tonight for spending your time with us. Time these days often feels like our most precious resource. The Brem Foundation is grateful for your time and also so grateful for whatever financial support you're able to give. Every dollar matters and truly counts. If you are so moved, we will be sending a donation link throughout the chat box during the program. With that, I'm honored to introduce our moderator, the one and only Sean Yancey. Sean Yancey is an Emmy Award-winning broadcast journalist and the former primary weekday news anchor at WTTG-TV in Washington. She founded Girls Night Out by Sean Yancey, Inc., a nonprofit working to improve the lives and empower the futures of women and children in need. She is a professional artist with clients nationwide. Welcome, Sean. Thank you so much for joining us.
Andrea, let's see. Hold on just a minute. Can you guys hear me? Can everybody hear me?
You're good.
Good evening. Andrea, thank you so much. And good afternoon, or I should say good evening to everybody out there. We're so happy that you're all here to join us for such an incredible evening with some important words and important messages. And also a lot of knowledge is going to be shared this evening. Let's introduce you first off to our panelists, Dr. Rachael Brim and Dr. Angela Marshall. We're going to talk a little bit more with Dr. Marshall coming up in just a few minutes. But first, let me tell you a little bit more about Dr. Rachael Brim. She's the Director of Breast Imaging and Intervention at the George Washington University Medical Center, Professor of Radiology, Vice Chairman of the Department of Radiology, and Chief Medical Advisor at the Brim Foundation. Dr. Brim has served as the Brim Foundation's Chief Medical Officer and inspiration since its inception back in 2006. She's a fellow of the American College of Radiology and the Society of Breast Imaging. She's also one of the scientific advisory board members of the Prevent Cancer Foundation. Dr. Brim is the recipient of countless awards. In 2015, she was ranked as one of the top cancer doctors in the U.S. by Newsweek magazine. Dr. Brim received her BA in biology from Brandeis University and graduated with honors from Columbia University School of Medicine. Dr. Brim completed her diagnostic radiology residency and breast imaging fellowship at the Johns Hopkins Medical Institution. Now, in addition to all of her clinical and academic accomplishments, Dr. Brim is a zealous advocate for early detection and has dedicated her career to finding effective and innovative ways to increase breast cancer prevention and early detection. Dr. Brim, thanks so much for joining us.
I'm thrilled to be here and to share this wonderful event on the first day of Breast Cancer Awareness Month. Thank you.
All right, so we know, as we heard, and for those of us who've known you and know about your work, and for those of us who don't, you are certainly a trailblazer in early detection of breast cancer. In fact, Dr. Oz has called you a cancer detective. How did you make breast imaging, radiology, as sort of your way of making a difference in women's health and in women's lives?
So breast cancer touched my life very early on. At the age of 12 in the 1970s, my beautiful, vivacious 33-year-old mother disappeared for 2 weeks. And when she returned, she was never quite the same. It was only months later that we were told that she had breast cancer with mutilating surgery in the 70s. we were told that she had 6 months to live, and because of early detection, she lived 44 more years. So I decided as a 12-year-old that I didn't want any other 12-year-old to be impacted the way our family was. And so here I was, dedicated to changing the face of breast cancer in America. So when I went to medical school at Columbia, it was a very exciting time in the 70s when we were first understanding and finding that women died less as a result of breast cancer screening. So I decided that's what I wanted to do. And as time went on, things became even more personal. So after training in radiology and breast imaging, I became the director of breast imaging at Johns Hopkins. And one night, charged with finding some new ultrasound equipment, I asked the vendors to bring all the equipment in, try it out. And there that evening, I found my own breast cancer. So I was 37. I had a 12-year-old, 9-year-old twins. History was repeating itself. And the silver lining to that was, firstly, of course, I'm here today. And second of all, that I got the opportunity to understand what it's like to be on both sides of breast cancer, the doctor and the patient. So here I am, 35 years into the privilege of caring for women with breast cancer, having felt it myself, and I have 3 daughters, 6 magnificent granddaughters. And so breast cancer for me is not a profession, but it's a passion. And it impacts every fiber of my being and every part of my life.
What an incredible story. I mean, to think that this started from your life experience at the age of 12 to where you are now. Thank you so much for sharing that. I know not everyone knew that story. It's absolutely incredible. We know that in your, I guess when you're out and you're sharing and you're talking to people, you often talk about risk-based screening and even personalized screening. For those of us who don't understand exactly what that language means, what does it mean and what do you want women to know most before they go in and they talk to their physicians about breast care?
So before we talk about risk-based screening, I want to talk about screening. Okay. And we've heard so much. I have to say, Sean, I am so grateful to you and the media, which has been the primary source of educating women truly about the importance of screening. But over the past few years, we've had so much noise, start at 40, start at 50, screening doesn't work, screen does work. So I think it's really important to discuss that. It doesn't matter who you are, whether you're the United States Preventive Services Task Force, the USPSTF, that says start at 50 and get screened every other year, or you're the American Cancer Society that says women 40 to 45 should decide, but everybody after 45 should have annual screening. Everybody agrees that if you start at the age of 40 and get a mammogram every year, more American women will be saved. We have had a 40% reduction in the death rate from breast cancer over the past 2 decades, an extraordinary feat. But if you look at the USPSTF, and they know that we've had this important reduction, and other organizations, you ask yourself, why are they not recommending screening mammograms at the age of 40 every year to save the most lives? So they say that if you do start screening at 50 and every other year, you will save 88% of the women who would be saved if you would screen every year at 40. Well, raise your hand if you want to be one of the 12% that lose their lives as a result of not screening. And the answer is every woman, unless you have other risk factors, should start screening at the age of 40. And there are some populations who should start earlier. There are women who have genetic mutations, strong family histories, and you should start 5 to 10 years earlier than the age at which a first-degree relative developed breast cancer. So if there's one message I can send, it's get your mammogram, start at 40, get it every year. One of the biggest things that drives me crazy is one of the biggest complaints about mammography, one of the biggest harms is that women are anxious. So sometimes when I hear that, I feel like I live in the Middle Ages. Aren't we empowered women who are entitled to decide for ourselves? And I can assure you that having cared for women for 30 years with breast cancer, if you tell them that they have another mammogram that needs additional evaluation, they're much less anxious than if you tell them they have metastatic non-curable breast cancer. And it's important to remember that breast cancer is a curable disease. 90% of early stage breast cancer is cured. So every woman owes herself the right to maximize her options of early curable breast cancer. And before I talk about risk factors, I have one more thing that I have to talk about, which is empowerment, women. You know, unfortunately, many of us are told to be good girls, but in the spirit of Ruth Bader Ginsburg, do not be good girls. There are so many times that a young woman with a child in tow comes and tells me that she's had a breast mass for a year, but the doctor has told her that she's too young to have breast cancer. So the answer is, nobody knows you as well as you know you. And nobody, even doctors, are infallible. So if you go to the doctor and don't get a result that you're happy with, go seek the opinion of another doctor, because remember, at the end of the day, although doctors are well-meaning, they're imperfect and human, and they go home and have dinner with their families, and these young women have to suffer the consequences. So you must go out and advocate for yourselves. So now risk-based screening.
Absolutely.
Right? So there are many risk factors. The number one risk factor for developing breast cancer is being a woman. 3/4 of women who have breast cancer have no other risk factor, no family history, no other risk factors. So just because you don't have any other risk factors, every woman has the number one risk factor of developing breast cancer. Other risk factors are family history, and you can have genetic breast cancer or familial breast cancer. Only 5% of breast cancers are genetic. However, in certain populations, it's much more common. For instance, in the general population, 1 in 400 women have a gene mutation, which they can get from their mother or their father, that results in a very high risk of breast cancer. In certain populations, that number goes to 1 in 40, like Ashkenazic Jewish populations. So family history is an important one. The next one I really want to talk about is breast density. And we've heard a lot about it. Breast density is how white your mammogram, how white your breast tissue on a mammogram is. And the reason that's important is because on a mammogram, breast cancer is white and breast tissue is white. So if you have a lot of breast tissue, it can obscure the cancer, kind of like trying to find a specific cloud on a cloud-filled sky. Now, the reason that's important is because of the density, 1/3 of breast cancers are not seen in women with dense breasts. And women who have dense breast tissue have a strong independent risk factor increase, 4 to 6-fold increased risk of developing breast cancer. So it's kind of the perfect storm. Harder to see, much higher risk. And you might say, well, how many women have dense breast? And the answer is 40% of American women have dense breast tissue. So it's really important for women to know if they have dense breast tissue. The only way you can tell is on a mammogram. You can be perky dense, you can be saggy dense, you can be anything dense, and the only way to tell is on a mammogram. So there are laws now that require women to be told as to whether they have dense breast tissue. There is a federal bill that's been enacted. There have been 36 states and the District of Columbia and that have passed laws. And I have to say that the DC mandate, the DC law was written by the Brem Foundation, was supported by the Brem Foundation, and is one of only a few handful of places in the country that requires insurance to cover additional screening in women who have dense breast tissue. So what do you do if you have dense breast tissue? Well, we know that ultrasound is a very effective tool in finding those cancers that are hidden in dense tissue on a mammogram, because the contrast is the opposite with ultrasound. Cancers are dark, breast tissue is white, so it's easier for us to see. So it's really important to know that if you have a normal breast density, no family history, a mammogram may well be enough. If you have dense breast tissue, you must get a screening ultrasound, and in DC, that is covered by insurance, by law. Other things are age, and age is a really important thing. The older you get, the greater your risk of breast cancer. But it's important to remember that 20% of breast cancers, almost 1/4 of breast cancers, occur in women between the ages of 40 and 50. So we must screen that population of women. In addition, there are things like atypia, if you had a biopsy that showed cells that are not completely normal. But also there are modifiable risk factors, obesity, diet, alcohol. They can impact your risk of breast cancer. And now we are actually going towards very exciting artificial intelligence. And I've had the privilege of working with a number of companies that use artificial intelligence on your specific mammogram to see what your risk is instead of all dense women. So we can now begin or on the threshold of stratifying even further dense breast tissue. And if you are at very high risk, like if you have a genetic mutation, and in fact, the American College of Radiologists this year put all African-American women as high risk because breast cancer is more aggressive, occurs more frequently in younger women. And in women who are very high risk, getting an annual MRI or contrast-enhanced mammography or molecular breast imaging, some newer technologies can find these additional cancers. So why are risk factors important? Well, you need to know them, so you need to know what to advocate for yourself to get the optimal screening to find the earliest curable breast cancer. Mammogram if you don't have dense breast tissue, ultrasound if you do, MRI, contrast-enhanced mammography, molecular breast imaging if you're yet at higher risk.
Dr. Brem, I want to go back to something that you mentioned earlier, the difference that we hear from different communities on when we should start the screening, start getting mammograms. And you said the age of 40. What if you go to a physician who's saying, no, I need you to wait until you're 50 or you're 45? What should you do?
You should go to a mammography facility and get a mammogram. Some do not require a referral, but if you do, you will find a physician. And that is part of self-advocacy. And you must remember that no matter who you ask, no matter what their recommendation, the data is overwhelmingly compelling that if you get a mammogram starting at 40, you will survive increasingly. And there's one more thing that people don't discuss, which is something called intensity of care. You know, it kind of reminds me of something that Yogi Berra said, there's lies, there's damn lies, and there's statistics, right? So if you look at survival, we are so lucky to be in a time that we have excellent therapies that women with later stage breast cancer can survive. But the journey that a woman has to go through to get to survival is so different with an early stage breast cancer where the surgery and the therapy is so much less aggressive than with a more advanced breast cancer, where yes, we hope they will survive, but they should have been found earlier so their journey would have been an easier journey.
Absolutely, absolutely. All right, let's switch gears just a little bit. Certainly, racial injustice and inequality has been in the news lately. It is a serious and pervasive problem in our country right now. And as we've even seen with COVID-19, how does it affect the outcomes of breast care?
It enormously affects breast care. So I said to you that there has been a 40% reduction in the death rate from breast cancer. The good news is that has been even more in African-American women. But the bad news is that there is a 40% increased mortality in Black women as a result of breast cancer. And there are many reasons for that. We have to really address each and every one. There's a cultural reason. There is access. Black women are more socioeconomically underserved, and there is less access to mammography. There's also a study in Chicago that looked at African-American community and the death rate difference. And they hired navigators to offer African-American women excellent care, not just care, going to centers of excellence. And if you do that, what they found is that the death rate in Black and white women were the same. So access is a big issue. The other thing is that the biology of cancer, breast cancer in Black women is different. It's younger, it's more aggressive. And therefore we have targeted therapy, we have genomic therapy, but it is critical that Black women participate in clinical trials so we can evaluate the impact of novel technologies on Black women and the impact on their survival. We won't know personalized medicine in Black women unless they participate in the clinical trials. So if you are listening, please do, not for the data, and there's some cultural, suspect as well-founded. However, we need women of all races to participate so we can optimize their genomic care, which is really cutting edge.
Good information there. And we touched on just briefly COVID-19. As we mentioned, it's changed everything. That's why we are virtual tonight. When it comes to getting screened and getting breast care, how do we navigate that? Is it even safe to go in, to the mammography center and get our mammograms?
So I want to get back to your last question for 1 second, and then I just want to say, if we were having this discussion 3 years ago, I would sadly say to you that DC had the highest death rate for breast cancer in the country. We are not there now. We have come down in that ranking, and part of that is access, like things like the B Fund from the Brem Foundation and Wheels for Women, where we found that not only is free mammography available, but if they can't get there, they can't avail themselves of it. So we are making headway. In terms of breast cancer and COVID, I get an email every day from someone that says, should I come in for my mammogram? Mm-hmm. And the answer is a resounding yes. Yes, yes, yes. Because we know that the American Cancer Society this week released that 10,000 additional people will die of cancer this decade as a result of the 85% reduction in screening that occurred in March, April, and May. And half of those, or more than half of those, will be breast cancer. So we have taken, and every breast center that I know of has taken great precautions to make women safe. Masking, temperature checks, questions, limiting the number of women, social distancing, deep cleaning between every patient. So the answer is, if I could tell what your mammogram would show without the mammogram, I could tell you yes or no. But until I can, it's yes for everyone. We know we are going to find later, less curable breast cancers. So the answer is go to a center of excellence, go to a center that you trust, but go.
So along those lines, I know there's still some people out there who are frightened. Are there any questions? If someone says, hey, I still have questions, what questions should they be asking that facility when they call to set up their appointment about safety or any sort of precautions?
Do you screen patients for COVID before they come in? Do you temperature check? Do you enforce social distancing? Have you changed your scheduling as a result of COVID to allow, is there more than 1 or 2 people in a waiting room at a time? And if the answer to all of that is protective, then go get your mammogram. The risk of getting COVID is in a well-run breast center is so much less, is essentially negligible, and the risk of breast cancer is not. So we have had to delay things by necessity, but we're not anymore. So go get your mammograms, advocate for yourself, and get risk-based screening.
Absolutely. All great advice. Dr. Brem, before we switch over and talk to Dr. Marshall, is there anything else that you think is important that you haven't hit that we need to share with everyone tonight?
I just can't emphasize enough the advocacy. Don't forget to advocate for yourself. Nobody knows you like you know you. We are very lucky to be in a time where we can significantly impact the death rate from breast cancer. We have much more to do. We have so much to do in terms of unequal care, but go get your mammograms, please.
Excellent advice, Dr. Brem. Thank you so much for sharing your personal story. Thank you for your expertise, and thank you for your insight. We really appreciate it.
Thank you.
All right, we're going to drop some more knowledge now. Dr. Angela Marshall is going to join us. And while we're waiting for Dr. Marshall, I want to tell you a little bit more about her. Dr. Marshall is the founder of Comprehensive Women's Health, Inc., a thriving primary care practice for women with 2 locations in Washington, D.C. Dr. Marshall also chairs the board for the Black Women's Health Imperative and is a staunch advocate for achieving health equity for all. Dr. Marshall is a board-certified internist and a fellow of the American College of Physicians. Now, she began her career as an electrical engineer for the CIA after earning a degree from Georgia Tech. Although she enjoyed the field of engineering, she decided to combine her love for both science and her passion for helping people by pursuing a career in women's health. Throughout her medical career, Dr. Marshall has affected the lives of thousands of women by providing a style of medical practice that emphasizes patient-centered, empathic listening, which we all know is so important. Washingtonian Magazine has repeatedly named Dr. Marshall a top doctor. She also has won various awards, including the 2020 Maryland Top 100 Women Award, Smart CEO Magazine's Bravo Award, and the Circle of Excellence Award. Dr. Marshall has also appeared on several news programs, including CNN, Fox, and PBS NewsHour. Please put your hands together and help me welcome Dr. Angela Marshall. Dr. Marshall, thanks so much for joining us.
Good evening. Thank you so much for having me.
You know, you also bring a unique perspective to women's health, especially as one of the practicing physician, as a practicing physician, also a member, or the board chair, I should say, of the Black Women's Health Imperative. What inspired you to sort of lead this charge to help women live healthier lives?
Well, first of all, thank you so much again for having me today. Today has such special meaning as the first day of Breast Cancer Awareness Month. And so this is almost like a holiday in our field of work. For the past 2 decades, I've served as a women's primary care physician. And one of the reasons why I chose women's health is because I've always believed that women deserve our own area of specialization, because women are not just men with female parts, right? We are different through and through. And I believe that we warrant our own medical specialty and our own attention and our own research for our specific issues. And so still today, as Dr. Brim mentioned, a lot of medical research is not done specifically for women, and certainly not for Black women. And even when women are included in some of the research studies, or when Black women are included, the results are often not reported out by gender or by race. And so oftentimes the research studies aren't very telling on how they affect us specifically. And so we definitely need more work in that area. But as a practicing physician, you know, I've really seen the plight of women in our society. And, you know, we've all heard the cliche, you know, we're taking care of everyone else. And, you know, hey, that's what we do, right? And so I felt that that was another reason why women really need good caregivers. They need good providers, good doctors and nurses and healthcare providers to take really good care of us. And so that is what drives me every day. That is my passion, taking care of women. And it's even more true for Black women, because as Black women, we're less likely to get equal pay for equal work. We're less likely to be supported in society, and more likely to be overburdened, overworked, despite being one of the most educated demographic groups in this country. And so my work with the Black Women's Health Imperative has also been so incredibly fulfilling, because I feel that I get to help this demographic group that represents me, but also a group that has so much to gain from our efforts.
Yes, indeed. I just have to ask you real quick, what inspired you to take that turn from engineering with the CIA to doing what you're doing now?
So, you know, I found working in science, I really love science. But to be honest, when I worked as an engineer, I worked with all guys, and they oftentimes didn't want to talk at all. They just wanted to do their work. And I'm very social. And I also really felt a need to feel like I was making a difference every day. You know, I really, there's something in me that makes me need to feel like I'm helping people every day. And I like the quote about Ruth Bader Ginsburg, and how, you know, she said that, and I'm paraphrasing, life has greater meaning when you feel that you're helping people that are less fortunate. And so that's what drives me every day. And I mean, it's not even work for me. It's my lifeblood. It's what I love to do.
I know, and I speak for all of us and say, I'm glad you made that transition. All right,
Thank
as
you.
we talked a little bit about this with Dr. Brem, this next topic. We know that there are health and racial disparities in breast cancer, as there are in many other diseases. According to the CDC, breast cancer death rates are 40% higher among Black women than they are among white women. Why do these disparities exist, and what can we do to change that?
Yeah, the disparities are really quite stark. In fact, you know, Black women are more likely to get diagnosed at a younger age, and African-American women have a 31% breast cancer mortality rate, which is the highest of any other racial or ethnic group. And so this is partly because breast cancer is more likely to be detected later. And so as Dr. Brim mentioned, yes, we need early detection. And so that means going to get our mammograms earlier. And so we've got to improve our education on this issue, I think. And we also need to improve access to care, access to mammography, access to health insurance coverage, and get the women the treatment that they need. The other factor that affects Black women more is that we're more likely to have the triple negative form of breast cancer, which is the less treatable type. And so again, early detection is a must.
Absolutely it is. When we talk about getting access to care or just getting the care that women need, how do they go about doing that? And I know that you've shared with your patients ways to sort of optimize their health, both mental and physical, and ways they can advocate for better breast care. How do they go about doing that?
Well, first and foremost, it's so important to have an annual medical exam along with age-appropriate cancer screenings, not just breast cancer screenings. I know that's what we're talking about today, but all the cancer screenings. And so again, I think it's so important. And it's so important to have a health provider that you trust, and one that's gonna work hard for your well-being. And so if you don't have someone that listens to you or that cares for you, keep looking until you find another. I wanted to share a quick story. I did have what Dr. Brim mentioned about advocacy really resonated, because I had a patient recently who was 74. She was a new patient, and she came to me and said her previous doctor told her she didn't need mammograms anymore, which was mind-boggling to me because she's in perfect health otherwise. You know, she's 74, but very savvy and spry. This was a few years ago. Well, since that time, we've diagnosed her with breast cancer in both breasts. So
Wow.
She's had left and right sided breast cancer since that time. And so it is so important to get those yearly mammography exams done. Also, most of the breast cancers that I've diagnosed in my patients were done on routine mammograms where we had no suspicion whatsoever. And so it is absolutely crucial to get these important screenings. It's also important to have more representation in clinical trials in the medical field as a whole, because representation allows us to get more specialized attention to some of these factors that differentiate us and lead to these disparities.
Let me ask you, you brought up a good point, and maybe there's someone watching right now who doesn't know. So when you're getting screened for mammograms, how long does that go on? I mean, at what age do you stop?
I usually recommend screening as long as you have at least 5 years to live. I know the data is a little different. I think the American Cancer Society says as long as you think you have at least 10 years to live. But I go as long as if I think they're going to live for at least 5 more years. That's what I usually recommend. But again, it should be personalized, and it should be done in consultation with their healthcare provider.
Mm-hmm. Okay, certainly good advice. Dr. Marshall, thank you so much for sharing your compassion and your passion for this field and your insight today. We appreciate it.
Thank you. Thanks for having me.
All right, we are going to now introduce you to a woman who is a breast cancer survivor. She is also one of Dr. Brim's patients, or former patients. Her name is Rochelle Wilson. Rochelle is an educator, an expert consultant, and a leadership coach. She received her BA in early childhood education from George Washington and an MS in organizational leadership from Nyack College. She's had a successful career in DC government. She is the owner and operator of, I hope I'm saying this right, Elocore Boutique. She is also the co-founder of the Success Geeks, Inc. Rochelle is the first lady and executive pastor of Another Level Church and has been a featured speaker on many channels, including Trinity Broadcasting Network and the Washington Post. Now, back in 2016, Rochelle released her first book, 6 Steps to Six Figures. In 2019, she released another book entitled Frugal and Fabulous, and she is looking fabulous and here with us tonight. Please help me welcome Rochelle Wilson to share her story. Rochelle, thanks so much for joining us.
Thank you, Sean. My name is Rochelle Wilson, and I have been on a breast care journey for about 20 years now. I'd like to first thank the Brem Foundation for this opportunity to share. Prior to discovering that there was a family history of breast cancer, I was diagnosed with fibrocystic change, and that's essentially fatty, lumpy tissues that can appear to be a lump in the breast. And this is what caused me to have my first mammogram at the age of 26. My first mammogram was such a scary moment because I didn't know what to expect, and I was all by myself. And while this has been somewhat of a unique experience, what has helped me the most has been the support and education that I have received from amazing doctors like Dr. Brem. Over the years, I've stood on the shoulders of every woman who has been in the breast cancer fight. I am extremely grateful for the Brim Foundation and its outreach efforts for women. The Brim has supported women from transportation to appointments and to access to diagnostic tests. They have really ensured that women have access to quality care and resources. For well over a decade, the Brim Foundation has leveraged these educational resources with the hopes to eradicate the spread of breast cancer. Now, as a woman of color with dense breasts, I know how important it is to have access to educational resources and quality care. And as well as all of those things, stand in contact with great physicians and great organizations. It's quite disturbing to hear and read about the breast cancer death rate for Black women, and hearing that it's 40% higher than white women is so disheartening. The Brem Foundation has continued to educate women about race disparities in breast cancer and rates and efforts to close this gap. Now, I'm here tonight, not as a breast cancer survivor, but as someone who's benefited from early detection education and access to health care. We know that there are many women without health care or limited benefits, and that's where the Brim comes in. The Brim Foundation is able to fill gaps so that all women have access to care, the care that saves lives. Now, with that being said, as I transition and close, I want to encourage each of you to invest in the Brim Foundation, because your investment can really save lives. The Brim needs your help today, and I want to challenge you to consider to donate on tonight, because you can do that while we're on live, while we're on this chat. I want you to look in the chat box and see all of the ways that you can donate. You can donate by way of the information that's in the chat box, or you can visit the brimfoundation.org and click the donate tab. Please know that everyone can help and every dollar can help. This is such a critical time for every single woman, because we know that access to quality care is so important, and we know that women are canceling their mammogram appointments due to the pandemic. And so again, I want you to know that every dollar counts. It's really simple. Here's how you can help. A donation of $102 can pay for one unilateral ultrasound. $290 can cover a diagnostic mammogram. $535 can pay for a biopsy. $1,084 can cover the cost of an MRI. And $2,494 can provide 43 round-trip rides to breast care services. Our goal tonight for this effort is $25,000, and we are close, but we still need your help. We are a little over $15,000. So as I said earlier, you can donate now while we're on live, or you can visit brimfoundation.org and click that donate tab. We want you to know that every dollar counts and every dollar will save a life. Now, this October, I want to encourage you to donate to the Brim Foundation and to be an advocate for breast cancer education and access to quality care. As I end, I would like to thank the Brim Foundation again for this opportunity to share. I am Rochelle Wilson, and I am a proud Brim partner, and I want to encourage you to partner with the Brim Foundation by visiting brimfoundation.org to support. Now, I'm excited to welcome back Sean Yancey for a robust Q&A with our doctors.
Rochelle, thank you so much. We appreciate you sharing your story. I mean, it is inspirational. We also appreciate you letting everybody know out there, this is also about raising money. So tonight is about educating you and also about raising money for the Brim Foundation. If you have a question right now, we want to remind you, you can put those questions in the chat. I will see those questions and we will ask Drs. Marshall and Dr. Brim. In fact, we have a few, so let me start with the questions you guys are asking. Dr. Brim, the question for you is, do you think women will be diagnosed later now because of COVID-19?
I think women will be some women will be diagnosed later as a result of the delay in screening. Time changes the early detection. So that's exactly why women need to go get screened. And I do want to mention something that Dr. Marshall said, which is older women should go on to get mammograms until 5 years, if they have a 5-year survival. And when we weren't screening older women because we thought it wouldn't make a difference, they were dying of breast cancer. So, so older women should get screened and everybody should get screened. Don't let the fear of COVID rob you of the opportunity for an early curable breast cancer.
I think that's super important. Yes, indeed. All right, Dr. Marshall, what are some of the critical things that will help close that gap in racial disparities with breast cancer?
Well, first of all, I think we have to address the issue of mistrust. And so, the African-American community, we've had some things like Tuskegee, Henrietta Lacks. There have been a lot of things that have caused a lot of disenfranchisement. And so we have, as clinicians, have to do the work to bridge the gap and to re-earn our patients' trust, because the disengagement is hurting our population. And so we really have to do more to gain trust. Also, I think we've got to work towards medical literacy. There are a lot of folks who are extremely educated, but may have low medical literacy or may not understand why it's so important to get these annual mammograms. Some people even think, there are conspiracy theories out there that the mammograms actually cause cancer, which is absolutely false. And so, dispelling some of those myths is really key. And then also just programs like this, programs like the Brim Foundation, just getting the word out, making sure that women understand that we have power and we can advocate for ourselves. And we are actually doing a great thing by caring for ourselves enough to go and get our mammograms.
Indeed. I think we keep hearing that same thing. Self-advocating, advocating for ourselves is so super important. Dr. Brim, this next question is for you. What technologies do you think will move the needle on earlier detection and better screening?
It's probably not a single technology. We're very fortunate that we are in a time of an enormous explosion of new technologies, artificial intelligence, both for finding cancers, risk-based screening, lots of, contrast enhanced mammography, lots of things. But what will move the needle is if we really implement risk-based screening. And now we've had it for about 5 years, and we know that only about 30% of women take advantage of screening breast ultrasound when they have dense breasts. So I think what will move the needle is education and implementation towards larger populations of women of the technologies that we currently have.
Okay, thank you very much. All right, we have a next question. Okay, this is for either of you. Dr. Marshall, I'll ask for you. How do I find out about dense tissue screening laws in my state? And this is someone who is from Virginia.
Well, I think it's good to talk with your insurance company first, and also talk with your healthcare provider and with your radiologist. Dr. Brim is a great resource, but I think it's important that everyone gets the screening mammography and ultrasound when needed. Dr. Brim, feel free to piggyback on that since you're the mammography expert.
So Virginia has the breast density notification law, as does DC, as does Maryland, as does 36 states. There is now a federal bill, but every state is different. So some states just say you have dense breasts. Some states say you have dense breasts and additional screening will find more cancers. And some, like DC, although we're not a state, says you have dense breasts, additional screening will find more cancers, and the law requires payment for it. So even though the federal bill is out there, some of the state laws superseded in terms of information. But if you are in Virginia, you must get your breast density information when you get your mammogram.
Dr. Brem, just let me ask you a little bit more. Someone wants to know if you could explain a little bit more about how the artificial intelligence works that you were talking about before.
So artificial intelligence are computers that actually learn. they learn, you know, they get lots of data input, and then they get more studies, whatever it is. There's artificial intelligence now in transportation, there is in all areas, so many areas of medicine. But what happens is, in terms of risk-based with artificial intelligence, is so much of the risk is population-based, right? You have dense breasts, this is your risk. But not every woman with dense breasts have exactly the same risk. So we now have the beginning of the ability to run someone's mammogram, an individual's mammogram, not a population, through artificial intelligence that will help us further stratify an individual woman's risk factor.
Okay. Technology is amazing these days.
It is.
We have another question, and this sort of goes along with the idea of self-exams, which I know is very, very important. Someone asked, what manual way are women to check for their lumps? They used terminology I've never heard before. I've heard clockwise, but also, or cutting the grass. The person said, my mom had a radical mastectomy in 1972, and he was saying he understands what you were talking about and can relate to you, Dr. Brem. But what is there a particular way that's better than another when you're trying to do a self-exam?
So first of all, thank you for that comment and for understanding. There are many resources. BremFoundation.org is now releasing a self-exam video. There are lots of videos online. But when you go see your healthcare provider, like Dr. Marshall, that is the person that will help teach you how to properly do it. And you must properly do it. It's self-exam, it's looking yourself at the mirror, looking for dimpling, other signs of cancer, nipple discharge. But we look towards Dr. Marshall and her colleagues to help educate patients and women.
Dr. Marshall, let me start this next question for you. How can people who are watching right now, how can they help in the fight against racial disparities in breast care, and what else needs to be done to close that gap?
Well, first, I think we need more implicit bias training among physicians and clinicians and healthcare centers. We even need to start it in the medical schools, because a lot of our issues related to implicit bias are because we have cultural differences. And so when doctors don't know how to speak with patients, patients get discouraged, and sometimes they disengage, and then we don't seek care at all. So I think it's really important to look at implicit bias and also cultural competency, understanding different cultures and how different cultures need to have information relayed in different ways. And so I think we just can't stress that enough. But it's a very complicated issue. I think we also need to work with minority communities and encourage people to find doctors and providers that they do trust. We are out here, and it's not all Black doctors that are going to care well for Black patients. There are a lot of, all multinational doctors that care well for our people. And so we just have to take the time, do the research, get referrals from other folks, and find the folks that are going to care well for you.
Mm-hmm. Thank you very much. Dr. Brem, this next question is for you. Please explain triple negative breast cancer, which is so pervasive in Black women.
So triple negative breast cancer describes whether certain receptors are on the cells of the breast cancer cell. So the triple is estrogen receptor, progesterone receptor, and HER2. So if your tumor has that, then we can use directed therapies to stop the cancer. We can use estrogen blockers or hormone blockers for estrogen and progesterone receptor positive cancers. And we have an incredibly effective drug called Herceptin that can stop the growth of cancers that have HER2 on the surface. But if your tumor has none of these, then we have to kind of throw poison at it to stop it from growing instead of very directed therapy. So the reason triple negative breast cancer is such a big problem is, one, it's more aggressive, and two, we don't have targeted therapy. We just throw chemotherapy at it in the hopes that it will impact it. And we're trying to find more directed therapies, which is why participation in clinical trials, particularly for underrepresented women, is important, so we can find this targeted therapy for their different kind of breast cancers.
Mm-hmm. I'll throw this question out there. either one of you can answer. Dr. Marshall, maybe we'll start with you. Can someone who has had breast cancer participate in the clinical trials that you both talked about?
Absolutely. There are trials for every type of people who actively have breast cancer. There are also clinical trials for people who have a history of breast cancer, or for people who've never had breast cancer to see what their risk of getting breast cancer is. So there's all sorts of clinical trials available.
Dr. Marshall, Dr. Brim, thank you guys so much for your insight, your knowledge today, and for just inspiring us to self-advocate, to ask questions, and to not be afraid during this time of COVID where people aren't sure exactly what they're supposed to do. Thank you for sharing your knowledge with us today.
Thank you
Thank you very
having
much.
me.
All right, we're going to turn the program back over to Andrea Wolfe, the president and CEO of the Brim Foundation. And for those of you who don't know, she is also the oldest of Dr. Brim's 3 daughters. Andrea?
Thank you, Sean. Thank you both. Thank all of you so much for being here with us tonight. I am particularly grateful for all of the 130 of you who are still with us on the phone. I know that even though I've been in this fight now for years, I learn so much every time, and I'm so grateful. I want to reiterate a couple of things before we close out our night. First, the Brem Foundation is putting out a pledge to make sure that women commit to themselves and to each other to go get their, not just their annual mammograms, but their personalized screenings this year. We will send that pledge in the chat, and it's also up on the website, www.bremfoundation.org. Please take it and spread the word. I see that we have a lot of men with us tonight. I am so grateful for you all. You are our secret weapons. Please, please share it with the women that you love, because you will likely be saving somebody's life. The other thing I'd like to reiterate is how much every dollar counts to us. Obviously, tonight was about education. Tonight was about coming together during a time when there's a lot of uncertainty. Tonight was about helping each other and ourselves. But we can't continue to do this work without the financial support. Whatever you can do is so appreciated. It is a time where many people do feel uncertain, not just about the virus, but about their futures. And we are at the forefront. We are doing innovative things that nobody else is doing in breast cancer and for women's health, and to close those health disparities and racial inequities. So please join us physically, financially, emotionally. We are most grateful. Now, I will let all of you go so that you can have dinner and enjoy the rest of your night. Please mark this day as the start of a month full of ambassadorship for this issue. Thank you all so much, and have a wonderful evening.
Thank you.
Thank you, guys.